Welcome to the recorded version of Supporting Families Through Hospice, part of the Family Caregiver Support webinar series brought to you by the American Society on Aging and a generous sponsorship from Home Instead Senior Care.
Now I'd like to read a bio of Molly Carpenter, today's presenter. Molly is an author, speaker, trainer, and family caregiver. She brings years of personal and professional elder care experience and training to families dealing with dementia. Molly works with a team responsible for ensuring that Home Instead Senior Care's network of 60,000 caregivers worldwide have the resources necessary to effectively provide quality care in the home and understand the importance of their work.
Good morning or good afternoon, everyone. Welcome to today's webinar. Today's topic is probably pretty familiar to a lot of us. But when you think about these series being about the family caregiver, it's a topic that family caregivers don't know a whole lot about, or maybe it's even an unknown topic, or it's not very well understood. So today we're going to talk about hospice and palliative care and how we can better support families through this process. Now, as you know, as we can all imagine, that the end of life is a time no family really looks forward to facing. The challenges for family caregivers run the gamut from physical and emotional strain and psychological stress, just tons of it, galore. And as professionals, we really can help them navigate through this physical, emotional, and spiritual journey with their loved ones. The first thing we can do is explain the differences in these two very important and unique care plans designed for individuals and their families, and that is hospice and palliative care. Now, Home Instead Senior Care, we partnered with the Canadian Hospice Palliative Care Association to develop training for professional caregivers and the family caregivers so that they could learn more about the end-of-life care and how to help the person who's dying or their loved one travel this path with courage and confidence. So today we're going to cover the following objectives on the next slide. At the end of this webinar, we will be able to explain the differences between hospice and palliative care. We're going to talk a lot about the physical, emotional, and spiritual changes that may occur. We're going to talk about the hospice team and really be able to identify the members of the hospice team and understand each person's role. We're going to understand and learn more about the stages of grief and then realize different ways that family caregivers can better take care of themselves. And as always, we close with the resources to really help the family caregivers through this journey. So let's first start by reviewing what hospice is and the differences between hospice and palliative care. So families really do not understand truly what hospice is, as I said in the beginning. Hospice is not always the last resort for the dying, and it neither hastens nor postpones death. Instead, this concept of care affirms life and faces dying as a normal part of living. It's a holistic approach for families that creates a unique care plan with the individual and the family caregiver at the center of this care and the center of attention. So when we talk about hospice, it's important to tell families that this is a normal part of living, and that's hard to hear, but that's what this care is designed to do, is to affirm life. Hospice not only involves an individual who may be receiving the care, the person may be receiving pain management and emotional support and that spiritual support, but hospice is also there to support the family caregiver, who usually is the primary caregiver through this whole illness. And so hospice care focuses on helping to improve the quality of life and helps an individual live with dignity during the time that is left. Its goal is to help people complete life's journey with comfort, dignity, and companionship. Symptom management is a major focus of hospice care. Relief and comfort are the goals when there's no definite cure for the illness. Now, statistics show that 80% of hospice care is provided in the patient's home or the family member's home or in a nursing home. There are inpatient hospice facilities that are sometimes available to assist with caregiving. They're not in every community, but they're becoming more and more available in different communities. And even though the family caregiver is typically the main hospice provider, a team of professionals, always led by the physician, of course, work together to provide that best possible care and meet the needs of the patient and family. So in conjunction with hospice, the term palliative care is often used as well. Some may use this care term interchangeably with hospice, but they're not the same. So let's understand more about palliative care on the next slide. Palliative care can best be described as pain-relieving or comfort care. People of any age can receive palliative care for a serious illness, whatever illness or chronic condition or life-threatening condition that they have. The goal of palliative care is to improve symptoms, thereby helping to relieve pain and stress from these conditions. It has a lot of the same areas of focus as hospice, as you can see on the slide. But as the last bullet point indicates, hospice begins when the person is no longer receiving that curative treatment. So the main difference is that palliative care can be used in conjunction with curative care, meaning curative care to cure the disease or prolong life, and the common examples I always use are chemotherapy or radiation therapy. And the other major difference is that Medicare does not cover the cost of palliative care, where it does cover the cost of hospice care. Now, I usually use a story when I'm talking to families about the difference between palliative care and hospice care. And I tell the story of a dear friend of our family's whose mother, Fran, she had not been feeling well for weeks. And so the daughter encouraged her to go to the doctor. And the doctor reported, did a bunch of tests and reported that Fran may have an infected gallbladder. So the doctors went in to do surgery to remove the gallbladder, and they made another discovery. The surgeons found widespread cancer during this procedure. They removed as much as they could, and then after the surgery, the doctors reported to Fran and her family the news of the cancer. Now, right away, Fran wanted to do everything to try to cure this cancer, and at this point in her care, her goal was a cure. So Fran's doctors basically were trying to strike this balance between comfort and the steps to help achieve a cure, which included things like additional hospitalizations and lots more tests, office visits, and the chemotherapy and radiation therapy. So this approach at this time is called palliative care. Well, after 6 months, Fran's medical team concluded that this intervention had no chance of curing her cancer. Nothing was working. And Fran sort of reached that tipping point where the burdens of this approach outweighed the benefits. She was not handling the treatments very well. Her quality of life wasn't very good. And so at this point, it made sense for Fran and her family to change their focus from cure to entirely comfort and really maximizing the time she had left, maximizing that quality of life and the well-being for her for the rest of her days. So she is now ready to embrace the hospice care or hospice philosophy. So I think it's important. A lot of us can clearly articulate the differences between hospice and palliative care, but when we're talking to a family, sometimes a story works a little bit better. So that's an example of a story you could use. I'm sure you all have a story you can use as well, but consider that approach. So by using a story, it's easier to explain this to families. Now, moving on to the next slide, we look at a number of the medical situations, including accidents and illnesses that can lead to hospice situations. Even though cancer reportedly remains one of the most common hospice diagnoses, many other terminal conditions are also referred to hospice. Conditions other than cancer that are included in that list are on the slide. So we have the COPD and lung disease, heart disease, congestive heart failure, strokes, comas, advanced liver disease, end-stage kidney disease, dementia, or Alzheimer's, and then any of the advanced neurological diseases, and HIV and AIDS is another condition. Now, there's generally no specific restrictions as to what conditions can be referred to hospice. Any disease that is deemed to be in its end stage, with its further treatment believed to pose more burden than benefit, can be considered a referral for hospice. And as we all know, it's when doctors make that referral or make that diagnosis, it's 6 months or less is the general time frame. Now, one of the greatest benefits of hospice is the team of people for support. So let's look at this support system on the next slide. A team approach can really help families make the most of their time together. And so let's start with that family caregiver, because they really are at the center of the hospice team and are the primary caregiver on the hospice team. Family caregivers typically provide care for their loved ones, and some of those examples include the day-to-day grooming and bathing and toileting and assistance with eating. However, caregivers can also look to other family members or other people on the team for support. So let's look at some more of the team. Let's look at that physician. An ongoing role of the physician is to generally manage the patient's symptoms and the pain. This involves that regular evaluation of comfort, and the physician will be in charge of any modification to the medication as pain and other symptoms increase or change over the course of the illness. Nurses are another huge member of this team. They generally check in to make sure that the patient is comfortable and that his or her physical needs are being met. Nurses are core on this team. Because they also help educate family members. They teach them techniques for personal care, how to administer medications, all those different things. Anything that they can do to help the family member learn the ways to keep their loved one comfortable. Social worker is another key member of this team. Once a family decides to use hospice care, social workers provide the information and really help coordinate all of the community services, such as different government benefits or different benefits or additional home care, different services that the family might need. The social worker, I sometimes consider like the connector. They are the ones, connecting the family to the nurses and to the doctor and to the chaplain and the coordinator of everything. They've got a vital role on this hospice team. Now, a chaplain is a part of most hospice teams. They're always available to provide that spiritual support to the person on hospice and the family members. Of course, families, if they are close with their clergy or their church or wherever they do, they can utilize those services as well. But a hospice team always has a chaplain available as well. Now, speech and physical therapists, they may not always be on hospice teams, but they're another group of people or professionals that may be required or may be needed as part of the team. So if a person needs help with speech therapy, maybe the speech therapist can give techniques for the family to use to communicate with the person on hospice. A physical therapist may need to help the hospice patient learn to move with a disability or a new device. So those two members are occasionally in and out of the hospice team as well. And then volunteers. Volunteers are a big part of the hospice team. They can help with support and companionship. They're available for families to utilize throughout the process. And then there's hospice aides. They include aides, I refer to them usually as home health aides, and they're available on an intermittent basis, usually one time a week, for assistance with tasks such as bathing, for example. Now, the entire team is there to support the person on hospice and their family with any physical, emotional, and spiritual needs. So although everybody on the team has a specific role, the other thing is that that's what makes hospice so unique and so wonderful, is that the team everybody is doing each other's role if they needed to be. So they're always, the social workers are providing a lot of emotional support, as is the nurse. So and a nurse could be providing spiritual support if the chaplain's not there. So it's the entire team is supporting the person and their family with all the needs. Now, there might also be a role for a professional caregiver on the hospice team. These are outside caregivers from in-home care companies that can be available to help with the care as well. Let's look on the next slide, some examples of what this professional caregiver and what role they can play on the team. One of the things is with hospice is that it's real easy for a family to become overwhelmed. And while hospice can provide much needed support to the patient, the life of the family caregiver many times includes providing that personal care and the everyday tasks such as meal preparation, housekeeping, and errands. And see, these duties, they add a lot more stress to the lives of that family caregiver. And when I have a story, when my mother-in-law, her mother fell, and immediately the doctor, said this was the beginning of the end, and she went on hospice. They had to make that decision of what do we do now? Do we have her stay at home? Do we have her go to a facility? Do we bring in care? And when talking through, the social worker did an excellent job talking through all of the options. And at the end of the day, she decided that she was not the best person to be the family caregiver, to do all of those personal care tasks. She just wasn't that. She just didn't want to do that. It was very few days that her mother had left, and she wanted to spend those days as the daughter and visiting and trying to provide comfort in her own way, but she did not want to have those other tasks to handle. So they did have professional care brought in. And while professional caregiving support is typically funded by private pay, just those few hours a day or a week meant a lot to that family. And it can mean a lot to hospice patients and their families. Professional caregivers can pick up where the hospice team leaves off and where other medical services end. Yet the hospice team came in once a week and did a bath for my mother-in-law's mother. And basically, they had a caregiver there providing support in those other times when the bath aide was not there. So the caregiver also helped with things like light housekeeping and meal preparation and would run errands occasionally for the family. So just those few hours a day, few hours a week really helped the family. Professional and trained caregivers can also help families. They provide a consistent face. They can be great at relaying information back and forth between the hospice team and the family, and they can always provide daily updates. So my mother-in-law was working at the time, so she did continue to work as much as she possibly could, but she would check in with the caregiver on a regular basis, just looking for that update. Now, it's important for families to understand what may occur, what may happen to their loved one during this process. So I want to start by looking at the physical symptoms that can occur during the hospice process. On the next slide. Thanks, Anita. There are physical changes that take place as the body begins to shut down, and the process of decline can vary. It can be either rapidly, it can be gradually. It really depends on the person and the illness that they have. So, for example, an illness such as congestive heart failure or COPD or Alzheimer's disease, they experience a lot of peaks and valleys where there's a time where things seem very grave and the death could be very close, but then they recover and come right back out of it for another few weeks and then go down again and then up again. So that's one of the things that's really hard for families to understand is the process of the disease process and what does that look like. Many of the terminal diseases progress, and so activities such as walking and eating and breathing will become more difficult and eventually become compromised. And as you can see on the slide, pain is the major physical symptom that can occur. there could be appetite changes. There could be shortness of breath or labored breathing. There's skin issues to consider. There's really an increased weakness, and gradually the person will need help with activities of daily living. And the longer it takes a disease to progress, the greater the physical changes can be and the more adjustments that may be needed to help this person. So the process can be very distressing to both the individual and his or her family caregiver. And I think as professionals, when we're working with families, I know this is probably the number one question all of us get is, what's this look like? How does this happen? How fast is this going to go? So even by being able to explain some of these things, to give them a general idea of what can occur, is very helpful to easing a family member's mind. And again, knowing that this team is there to support them also makes this a lot easier for them. Now, what about diet and nutrition, though? Let's look at the next slide, some tips that we can share with family caregivers about diet and nutrition, because nutrition can play an important role in the final weeks and days of an individual's life. It can provide actually a lot of that comfort and well-being for the person. But eating can become more difficult as the individual's illness progresses. Caregivers may need to adapt the diet to ensure that the individual has the necessary nutrients. So here's a few mealtime tips that we can share with families when they're caring for somebody on hospice. I think the first one, plan small, frequent meals with their favorite foods. Both of my grandmothers were on hospice and passed away, but my dad's mom, she loved the Marie Callender's pot pies. I don't know if you've ever seen those in the grocery stores in the freezer section. They probably have 100 grams of fat in each pie. At that point, though, it didn't matter, and she loved those pot pies. So we would always make sure that we had plenty of those on hand, so when she was hungry, she may only eat a fourth of it at a time, but she loved it. My other grandma, she loved toast with jelly. She could eat toast every single meal. She loved it so much. I secretly think it was the jelly, though. But when she was on hospice, that was a common thing that she always asked for. It was always available for her, so that she still would have that favorite thing that she used to have every single morning of her life. So she relied on that. Another thing is that keeping the portions small. When a person is on hospice, they have a limited appetite. So putting huge portions on a plate can really sour an appetite instantly. And I think that's hard for families to understand. They want them to eat, and they want them to eat as much as they possibly can. But if we go back to the point one about small, frequent meals, we would offer my grandmother toast a couple times a day, and sometimes she'd eat it both times, and sometimes she wouldn't. Sometimes she'd have one piece, sometimes she'd have two, and that was okay. But it's just getting around that mindset that it's okay to not eat as much and not offer as much. I think another good one is serving beverages between meals rather than just with meals. Liquids served with the meal can sometimes make that person feel pretty full. So think about the amount, different beverages that we get served between the meals with snacks. Always create a comfortable environment so the person feels relaxed and not rushed while eating. We all like to eat in a comfortable environment, and with hospice, I think the biggest, what I've seen in my experience is it's a slower process. So making sure that person is comfortable and relaxed is really important. And then again, the last one which I've said, and I know you've all have counseled families on this, is not to force the person to eat. It's very hard for families to understand that, but forcing can cause a lot of distress. And I think the hospice team, the nurses, the social workers, everybody does such a good job in, telling the family it's okay if they don't eat. It's okay if they don't eat as much as they used to. Their body doesn't need as much nutrient, so on and so forth. So I just think that's an important one. It's probably the hardest one families have to deal with. I also think another one, make sure the person's always sitting upright during and after meals, just to make sure, prevent choking and promote digestion is also a good tip. Okay. Mouth care is also something a family caregiver will need to consider. So on the next slide, let's look at some tips for mouth care. Now, the most common mouth ailments include dehydration, some kind of fungus infections, open sores, cracked lips, poor-fitting dentures, decaying teeth. And some individuals will be able to brush their teeth and tongue or rinse their mouth, and if it's not possible, we'd always encourage family members to talk to the hospice team for help. There may be some steps that the person can take to keep their mouth clean. For example, oral swabs or the oral swabs for people who are unconscious or unable to perform their own oral care. Also, there's some tips as far as rinsing the mouth frequently, giving the individual shaved ice or frozen ice cubes to suck on, giving liquids frequently with a straw, sometimes even a teaspoon or a syringe without a needle if the person is able to swallow it okay and while they're sitting upright. I think families need to, they'll still need to care for dentures, remove dentures, brush the dentures in the morning and at night. So there's lots of things around mouth care, and what we encourage is for families to ask the hospice team for support around those different ideas. But these are just a few to share with them to use right away. Okay, on the next slide, let's look at pain awareness because that's very important, like I said, when we're discussing these physical symptoms. And as a lot of us understand, the person on hospice is going to most likely experience pain as he or she approaches death. I think families expect this too, but it's important that they understand more about how to handle the pain when it occurs. Here's some important tips to convey is a person's reaction to pain is subjective, and when two people experience the same type of pain could react completely differently. So when we need to tell families when their person makes a statement about pain, we've got to take that seriously. We'd always want to encourage families to call the hospice company or the doctor if the pain is occurring that is different, meaning maybe it's more intense than usual. And then we really need to encourage family caregivers to gather as much information about the pain, such as the type of pain. For example, is it throbbing or dull? Is it continuous? And then maybe about location. Is it, where is it at, first of all, and then is it deep or is it close to the surface kind of pain? There's a really important lesson to telling families to really understand, to gather as much information as possible. It will just make that hospice team and the nurses be able to handle the situation quicker. We have to encourage families to also have the person rate the intensity scale using a 0 to 10, with 10 being the worst level of pain imaginable. Now, hospice companies and hospice teams, they provide training and education to families on like the type of medications that might be being used or and how to administer medications or if that's possible. And hospice teams are also talking to families and educating them about the proper pain management schedule. So this is important to convey, again, ensuring families that the team approach is there and there is extra support available. There's also alternatives to treatment of pain, such as a gentle massage or heat or cold therapy. Even music or visualization exercises may help. So encourage families to understand these options as well. Even sometimes if the pain is different this time and it's a lot worse and you have to wait for a new prescription or a nurse to come over and give another pain med, these types of alternatives to treatment of pain will be very beneficial for families. Now, the emotional toll of the end of life can be just as daunting as all of these physical ramifications. So on the next slide, let's look at the emotional toll and some of the needs of a person, a family, when they have a loved one on hospice. Now, when someone is faced with death, it can arouse a wide range of emotions. People react differently when they're faced with their own mortality. Some instances may be the stage of life they're in. It could be their personality. It could be their religious beliefs. But people who have suffered major physical losses and have lost their dignity and self-reliance, or who have been very ill for many years, they may react differently than someone who has not. So we really need to help families understand that everyone is an individual and the needs, they need to be dealt with in their own way. Each person deals with death in their own way. People who are dying should be given an opportunity to express their feelings, whatever that may be, because it's part of grieving and gaining closure. Supportive relationships allow for open communication, and they give the dying person the freedom to express emotions, including a wide range of emotions such as anger and fear and frustration, sadness, joy, hopelessness. There's so many emotions. One of the hardest things that I think families have to cope with are questions that their loved one may ask them about dying and about this experience. On the next slide, let's look at some of those common questions that may be asked. As you can see, there's the list, and in general, when faced with these questions, we should tell families that they should focus on what's still possible, not what is being lost. And it's important to stress the idea of living until death. So I'm going to read the question, and as I'm reading them, I want you to think about how you would answer these questions. And maybe you know an answer because somebody's asked you this already in your situation. So think about how you'd answer these questions. So the first one, am I dying? A couple of responses could be, I don't know, but I'm here for you. Or, do you feel ready? Or, what do you think? Do you feel like you're dying? Do you think you're dying? The next one, why me? Some possible responses could be, you can be honest, I don't know. Or, I'm sorry this is happening to you. I am here for you. I am here if you need to talk. If the person states, I'm not ready to die, again, it's okay to empathize and say something like, how frightening and heartbreaking it must be to hear this news. But I'm here and I'm going to keep you as comfortable as possible through this process. Or we'll all work together as a team to help make this easier for you. Or this is really sad. This is bad news and this is really sad. I'm sorry. And or what can I do to help you prepare? If the individual is crying, I think an approach could be, would it be okay if I just sat here with you and kept you company? If you want to talk, that's fine. If not, I'm grateful to just be with you. We don't have to talk at all. It's okay to just tell the person those things. What if we're dealing with challenging relatives? A lot of times there's other family members, they're upset when they learn that a loved one is terminally ill and on hospice care. And there's several ways you can bring them together into the process and make them feel relevant. Like, we can do this together. We're a team. You're part of the team. We all have a role. Let's talk about what your role is. So I think when there's difficult family members, it's usually because they don't understand and they're feeling isolated or out of the loop. So just by saying we're all in this together and everybody has a role can be very helpful. There are more ways to encourage family caregivers to support the emotional needs of their loved one. Let's take a look at those on the next slide. And I think these are, in general, when we're talking with families, these are some great things to convey. Being honest is the number one thing that they could do. Always be upfront and encourage them to tell the truth. Avoiding the cliches such as, well, everything's going to work out, or you'll be back to your old self in no time. On the last slide, we talked about the questions, and so that's when if they ask, "Am I dying?" You don't want to tell the family to say no. You'll be back to your old self in no time. But instead of saying yes, you're dying, that's one approach. But another approach could be, like we said, I don't know, do you feel like you're dying? What do you think is happening right now? I actually had that very experience with my grandmother. She said, what's wrong with me? Do you think that am I dying? What is happening? And I said, Grandma, what do you think is happening right now? And she said, I think I'm starting to pass away. So that made it easier for both of us to just have this conversation, and I didn't have to say, yes, you're dying. I didn't have to say those words, which were very hard to say. So there's just some ways to help families get around this and really get through these types of questions. We also need to tell families that rather than avoiding the questions, acknowledge the importance of the question. Sometimes they're going to have to look to the hospice team and professionals like all of you for the answers. So if the person asks if the illness is terminal, another approach would be, well, it sounds like you're very concerned about your illness. Let's talk to the doctor. They'll be able to answer the medical questions, or, let's write down your concerns and we'll talk to the doctor when they visit later. So even if the family is that nervous, I know it's all hard for us professionals to answer those questions too, but sometimes we do have to play that role for the family. Being non-judgmental is very important in these situations. Again, we talked about how people deal with death differently and they manage their feelings in different ways. So encouraging families to listen with an open mind and understanding that everyone copes in different ways based on their experiences and their personal beliefs. Not arguing with the family with a person who is in the stage of denial. Denial could just be a defense mechanism, and that may be what they need to cope. So families have to learn to not take anything personally. If they are angry or they argue with their family, they have to realize that anger and frustration, they may just be directing at them, but they're not really angry with the family. Again, such a hard lesson for families to learn. I think another big tip is allowing for silence. I think that people often feel the need to talk and to fill up the room with idle chatter. I think a great technique is to encourage families to match behavior. If the individual is tired, for example, or they have nothing to say, maybe they don't have the energy to talk or have a conversation, or maybe they're thinking about something, processing something or thinking about something sensitive. So if the person doesn't respond to the attempts of the conversation, take that as a cue and kind of match the behavior. Just let it go. And, I think it's important that families understand they have to put their need to talk on the back burner in these types of situations and look for another opportunity to talk at a later time when the person may be ready. Respecting the person's space. Each person may feel differently about how close they allow the family caregiver to be during conversations and during the process. Some people prefer to be alone. It's as simple as that. So it's just, again, understanding more about the person and what their wishes are. Now, family caregivers themselves, this is a very emotional journey as well, and they may be experiencing grief as well along the way. Of course they are. So hospice is all about caring for that family. So let's take a look and review the stages of grief on the next slide. These stages of grief came from Dr. Elizabeth Kubler-Ross. I'm sure all of you have heard of her. She's a psychiatrist and author of more than 20 books related to death and dying. She deemed that there are generally 5 stages of grief when an individual is facing loss. They are stages that are denial, anger, bargaining, depression, and acceptance. And I think these stages are pretty self-explanatory, but awareness of the stages can really help people understand their emotions. So by having just the 5 stages as a general bit of information, when families talk to you, I think it's great to mention these and talk through them so that people understand that there is a process of grief here. There are some stages. Now, Dr. Kubler-Ross noted that the stages can occur in any order and they can overlap, And not everyone experiences all 5. People's reactions are unique as they are, and some people may experience various reactions at once, while some people may not react only in one way, and a person's response can change from day to day. So again, just awareness to families so they understand that this is all normal and what they're experiencing is okay, and it's part of the process is the important. So a lot of you may be in a role to support the family caregiver. So on the next slide, let's look at ways that you can respond to their grief. When a person is grieving, they're going to look to you for strength and comfort. Sometimes they want to just share their feelings, and it's important just to allow them that time to share their feelings. Here are some examples of responses that you can share with families, and you can see them there on the slide. I'm not going to read them all, but it's things, I'm sad, I don't know why, what can I do for you, I don't know why this happened, this must be hard, tell me what you're feeling. It's okay to respond to their grief in this manner. It's okay. They want to feel that support and comfort from you. These actual quotes and phrases on the slide can also be shared with families then so they can respond to their loved one's grief as well. So again, it goes back to answering those questions. These are just some more of those answers that might help us. Now, spirituality is another area of focus in hospice care. So on the next slide, let's learn more about how spirituality, faith, and religion can play a role. I want to talk about what the difference is between, though, spirituality, religion, and faith. Spirituality helps people deal with the unknown elements of life and gives purpose. It also helps develop inner strength that can be used during times of trouble. Spirituality gives a feeling of connectedness to a higher being of power. So everybody's spirituality is unique, and spiritual wellness is achieved as a person's actions become more consistent with their values and their belief system. Now, religion is often used to describe an organized collection of beliefs, cultural systems, and worldviews that relate to humanity to an order of existence. Spirituality is not necessarily religion, as someone may belong to a religion but is not spiritual. And then faith is the confidence or trust in a person or a thing that doctrines or in the doctrines or the teachings of a religion or a view. Now, I heard a hospice chaplain say once that whatever brings the person joy to your life can be a spiritual experience. So for some people, sitting outside and listening to music can be just as peaceful as attending church or reading the Bible. So I think that's key for all of us to know and to convey to families as well. I know in my past roles when somebody brought up spirituality, I didn't know if I was equipped to help somebody, based on what religion or how spiritual they were, where their faith was. It seemed like an overwhelming task to help figure out, like, what do they want me to do? Do they want me to read the Bible? Do they have a different religion? What do they want me to do? But I keep going back to this hospice chaplain said to me, whatever brings the person joy can be a spiritual experience. So it's all about knowing each person and really looking at their individual, what they want and what they like and where they're at with their spirituality. Now, there is an exercise that family caregivers may consider doing with their dying loved one. Let's look at some of those questions on the next slide. This is one of those where the family member can initiate, or maybe the loved one brings up the topics. But these are some of the basic questions that might get asked or need to be discussed. A few of the examples are, what did my life mean? Where will I go when I die? Will my family be okay after I die? Is there any unfinished business I need to complete? I think this is one way to help sort of a person meet their spiritual needs, is to really talk through some of these questions. There's also another tool or another thing is a life review that might be beneficial as a spiritual activity or spiritual exercise. And a life review is just helping to gather some information and answer some of these questions. It also, though, can help reaffirm the meaning behind a person's life. And so the questions, there's no formal, there's a lot of tools out there and lots of life reviews and these spiritual type of questions out there, but they can be asked whenever over a certain period of time. They can be used when you can use a tool or you don't have to use a tool. There's no really set way to do a life review, but some different life review questions that aren't on the slide are things like, that might be kind of fun even for the person to answer. What advice would you give to your children or grandchildren? Or what is your most cherished family tradition? Or what would you like your family to remember about you? And then the last one, tell me more about your defining moments. So a life review can be another great activity that the family can do, volunteers can do, that outside professional caregivers could do. It's just another one of those activities that can really help the person get, become more comfortable with their own mortality. Now, a person on hospice may go through the phases of what we call relationship completion. And so let's learn about this concept on the next slide. The most important thing in life is our relationships with those we love. And Dr. Ira Byock wrote a book, The 4 Things That Matter Most, and he has 4 things a dying person must do before saying goodbye to a loved one. These 4 things are asking forgiveness, offering thanks, offering sentiments of love, and then saying goodbye. And collectively, these are called relationship completion. Even if these are expressed in a letter or a card, it is an important part of the dying process for some people. So we need to help families be prepared for this conversation. At the bare minimum, give them a heads up that this may occur. I have a very dear friend whose father recently passed away, and she was kind of a rocky relationship with her father for most of her life. And so when he went on hospice, she just did not know what to expect. And I told her one day that this is something that could come up, that, your father may want to reconcile the relationship with you, and here's some things that might happen. And she said to me, no. He's already reconciled with his pastor and his church. That's what he's done. That's the most he's done. And I said, okay, well, just in case, this was on a Friday and she was spending the weekend with him, these are the things. And I went over this list of the relationship completion type of activities. Sure enough, Monday morning, she says to me, it happened. It happened, Molly. And I am so grateful you told me about this, because I would have never been prepared to have this back with him. I would have never been prepared to answer. I would have never been prepared to reciprocate. I forgave him. He asked me for forgiveness, and I forgave him. I asked him to forgive himself because, he kept beating himself up for our tough relationship. I thanked him, and he thanked me. And as she's telling me the story, she's crying and telling me the whole story. And it was just, she said, I don't know, that would have caught me so off guard if I didn't know that possibly could be coming. So I think that's one of those situations where it can be beneficial to talk to families about these things, these tasks. Now, helping a family through the final hours is one of those really tough moments, and you've probably get asked about this a lot. So on the next slide, these are some of the common things that can occur in the final hours, and a lot of you probably have been there maybe for these final hours and witnessed this firsthand, but breathing changes. Breathing may be fast at 1 minute and slow the next. We've all heard about the death rattle, which is that where the saliva and the mucus is in the throat, and the breathing kind of sounds like gargling. It can sound like rattling or fluttering, and so a lot of people refer to the death rattle that could occur in breathing. The person's eyes can become glassy or tearing or half open. The skin can develop that purplish, reddish, bluish pattern as a result of reduced blood circulation. This is referred as mottling. And the pulse can become really weak and hard to find. The other thing is that a person that's nearing death may have that surge of energy, and they may want to get out of bed and have a big meal and talk to their loved ones, but we have to reassure families that this is energy that will most likely not last very long, but it's such a special time for families to get that last meaningful conversations in. Now, there's also some additional signs the person who is dying may show the family as they near death, and these have been documented in a lot of the hospice literature, and they're fairly common, but they're not definite in every dying experience. Maggie Callahan, there's two hospice nurses, Maggie Callahan and Patricia Kelly. They worked with over 2,000 families, and they coined these signs as nearing death awareness. And some of these could be that they may talk about a person who has died in the past. They may be gesturing, or they may be smiling or reaching for something or someone. They may have dreams about people or places in past events. And the family should basically pay a lot of attention to these words and, understand that these are signs that death could be aware or could be near. So I think that making sure families understand the expectations in the final hours, this is a really big role for a lot of us in this industry, in this field. And so just making sure that they understand these things, making sure what's going to happen in the final hours is very important. Okay, on the next slide, let's look at how we can support these family caregivers even more, because we know they're not caring for themselves very good anyway, and when somebody's on hospice, it's a whole nother set of stress and worry. And so we know they're experiencing a lot of emotions. It's important that they accept their feelings, both the positive and negative feelings, and kind of avoid judging themselves for feeling what they feel. This can really make a person even more frustrated. Again, reassuring them that a lot of people feel the way they do, and it's normal to feel many different, sometimes contrary emotions. And it's also important not to bury these emotions. So it's important to tell them to join support groups and talk to friends and make a list of things you're grateful for. Celebrate the small victories. Let their feelings out. Encouraging them to exercise and meditate and maybe even encourage yoga. A lot of these tips to really help them get through this process. It's even okay to encourage them to cry. Simple as that. And so on the final slide, let's look at some additional resources that we can share with families so that they know, so that they understand what's available. Again, Home Instead Senior Care, we have a lot of hospice resources on caregiverstress.com. The Canadian Hospice Palliative Care Organization and then the National Hospice and Palliative Care Organization, their websites are there. They've got lots and lots of great information. And then the Hospice Foundation of America is another area to gain some great educational materials. There's a couple of books, too, if you were during the webinar. The Final Gifts or Final Journeys, those are the two books that are written by those two hospice nurses. And then The 4 Things That Matter Most, that book is by Dr. Ira Byock, if anybody's interested in reading more about that book. So again, I thank you all for joining today and listening. I'm going to turn it back over to Anita with any final questions.
Thank you so much, Molly. This was really helpful. And as a personal note, I just wish I had known this information before I was a caregiver for my husband, who passed away at 51, because I think our biggest regret was that we didn't involve hospice sooner. So thank you for this, especially for showing how to and helping family members and people who are professionals in this field know the words to use to move towards hospice sooner. Well, I have some great questions here, and we have a limited amount of time, so let me zero in on them.
Okay.
Can someone who's on hospice palliative care go out on lunch and other outings with family and friends, or do they need to be at the housebound stage?
Yes, they can go out with family and friends and still try to do some of those activities that they're used to doing. I don't believe there is any restrictions on those types of activities.
Thank you so much. I have a comment here mentioning that occupational therapists also have an important role on the hospice team. Great. So
absolutely,
just in terms of helping the people, and
that's a great comment, and that's absolutely true. And that's probably another one of those big ones that's pretty frequent, especially when helping families learn how to do bed bathing or some of the different techniques as well. So yes, helping the person cope with new disability or weakness or increased issues. You're right. That's very helpful. Good comment.
Great. And another question was for me, I guess. Can I get a copy of these slides? Yes, as mentioned, and as Patty will send out in the chat, the email address to request the slides is the word info at aging.org. So it's info at asaging.org. Here's another question. I was told that if a patient is receiving skilled care in a facility, palliative care is covered under their skilled Medicare benefit. Do you happen to know if this is true or false, Molly?
I don't know that to be true. I think that it's moving that way. I don't want to say yes or no. I do not know the answer to that. I think we could definitely get the answer and do some follow-up if necessary. I think it's moving towards funding, but it's not. And I think there's different ways. That's why this gets a little tricky, because I think there's different ways that palliative care and some of the things that you would do under palliative care could be covered by Medicare. So that's why I don't want to say yes or no completely. I'm very sorry that I don't know that answer. That's a great question. I will do some more research, and if somebody wants to contact me, I can follow up.
And it looks like we're running out of time. So what I want to do is, again, remind everybody, if you want CEUs, just be patient. Wait for the email that will come at the end of our day here on the Pacific Coast. And I also wanted to really thank Molly for this extremely enriching and helpful web seminar, and thank our sponsor, Home Instead Senior Care. Without them, we wouldn't be able to put on these quality web seminars from Home Instead, and they've really been wonderful this year. So thank you all for coming. We look forward to seeing you at the next event. And if you have any questions, again, just send us an email to the info email or respond to Steve Moore later today. Take care. Have a great week, everyone.